So maybe we can start with you, Eduardo. You founded Keldoc in 2012, as far as I remember, and yeah, you've growing since then. And maybe you can share with us what you're actually doing, what Keldoc is about, and how you happened to found it.
Okay, so unlike most of the entrepreneurs I've seen today, I think we're actually tackling the simplest problem in healthcare. What we're trying to do is basically make life easy to patients. When a patient needs a doctor, normally he cares about four things: the quality of the doctor, the price, the location, and the availability of that doctor. When is he going to receive me? So I don't know if you can pull the app on the screen. This is an app that we're launching in January. And basically, all we're doing is basically giving the patient so a map to see all the doctors that are around him. He can filter by price, and he can actually basically see how long before a doctor receives him, which is one of the biggest problem for a patient, but it's a very, very simple problem. So that's on the patient side. On the doctor side, we're plugging into all the softwares that they're using so as to simplify a lot of problems. There's 28 million appointments that are not honored by patients in France per year. So we're spending masses of money just because patients forget their appointments. So this is a very, very simple problem, but that has huge consequences on the healthcare system in France.
Okay, great. Well, now that you're mentioning France, why did you start it there? I mean, you have a kind of multinational background. You grew up in Spain and studied in London, so why France?
Basically, the French healthcare market has always been, I think, a reference for me and I think in Europe. And I think France, to do what we do, is the hardest market. So I guess we thought that if we can do it in France, if we can overcome the regulatory barriers and the technical barriers that there are in France, we can pretty much do it anywhere. So
sounds great. So maybe you can step to Kyle now. You, you already conquered a couple of different markets already with MySugr, and maybe you can tell us what MySugr is actually doing and where you already operate. Very excited. And maybe you can also share with us something. You have a new initiative called MySugr Academy. What this is all about.
Thank you. And thanks to everyone here at TheFamily for inviting MySugr to participate. So MySugr is a digital health platform for people with diabetes. We try to create a lot of flavor of fun and engaging techniques that we feel like the medical industry is lacking for people with diabetes. Our flagship product to date is the MySugr Companion, MySugr Logbook with an Attitude, we like to call it, that uses a dashboard with a Tamagotchi-like avatar that is actually called your diabetes monster. So you're thinking diabetes monster, oh my goodness, it's scary. Well, it is scary. And the whole idea is that what we try to do is make it a little bit less scary and maybe even a little bit fun. We're an initiative that was started by a number of people with diabetes. I have type 1 diabetes myself. My co-founders had diabetes, or have diabetes, I should say. And we're based in Vienna, Austria. So we're based in Vienna, Austria. I look after our US operations, which started last year. And the MySugr Academy is our first kind of foray into diabetes education focused on type 2 diabetes. Cool. This is a video series which I think shows a lot of the flavor and fun that MySugr includes across all our products. And I think we have a video to cue, maybe about a minute long, that'll show you what it's about.
Huh.
According to your blood tests, I'm very sorry to tell you that you have type 2 diabetes. Tame your monster.
So I see some smiles and some looks of confusion in the room. That's what we're hoping for. So mission accomplished. This is a teaser. It's a 10-video series, and the idea is to replace perhaps traditional diabetes education. When I was diagnosed, I was handed a stack of literature this high, and I was sent home to learn about my new chapter of life. And so we want to try to keep it interesting and fun, and that is just in the process of being launched in English and in German. Our flagship product, MySugr Companion, is available in approximately 40 countries worldwide.
So Kai, you started with tackling diabetes type 1, and now you have an initiative for tackling diabetes type 2, which is like growing the business even further. So how important is innovation and being flexible for a digital health entrepreneur? What would you say?
I would say absolutely vital. You know, our motto, I think, back in Vienna is iterate, iterate, iterate. If we can't do it, then certainly the big pharma and big medical device companies aren't going to be able to do it. So we have to be able to do that. Some examples I would say that come to mind are connectivity. So device connectivity, we have some wonderful examples of people who've already presented and representing organizations in the room that have both devices and solutions that we are very interested in connecting to at MySugr. We're in the process of kind of developing our connectivity roadmap. But what we found with the mass market meters, so I'm talking traditional blood glucose meters, is that the industry is slow to develop Bluetooth connection, right? And so in the meantime, we've developed the MySugr importer, which will allow us to use an OCR algorithm to actually import that data from mass market meters. And I think the reason that's important is that people are creatures of habit. We've talked about behavioral medicine a lot today and yesterday. If people are using a device, some people are going to stick with that device. And so if we can somehow digitize that, these mass market meters that people are using at home, then we can bring that data in and make it part of our own health platform and share it with others, I hope.
Great, thanks. And if we talk about innovation and being like first mover, we should talk about Voluntis. Etienne, your company was one of the first movers in cloud technology and healthcare. It was founded in 2001 already, which is really, really early for a digital health startup. And you also tackle diabetes. You also try to focus on this disease, but you focus more on pharma industry and medtech, medical device industries. And maybe you can explain us why you are focused on these companies and what Voluntis is actually doing.
Yes, thank you. Well, first, I need to apologize. I'm not Pierre Laurent from Voluntis. I'm Etienne Vial, one of his co-founders. But well, I hope you have noticed that I don't have the same face on the picture. Yeah, so that's true that we have a product today on diabetes, but this is not exactly what we're doing. This is our main business today, but we want to expand beyond the diabetes. And to elaborate on this, let me focus on let me explain what Voluntis is doing today. We're building what we call companion softwares. These are web and mobile solutions that are designed and developed to help the patient in his daily life and daily treatments, by instance, by helping the patient to be compliant, recommending those adjustments, or helping the patient to communicate with a physician. And these apps are not just softwares; they're regulatory-wise medical device. So this is a huge difference, because when you're a medical device, you can claim a medical benefit. And if you want to claim a medical benefit, you need to be a medical device. There is a close relationship between the two. And this is an emerging market today. Out of, we've said, 50,000 medical apps today on the stores, we'd say there is 100 that is cleared. And 20 that has medical evidence in it. And our solution in diabetes helps the patient to adjust its treatment. It's called Diabeo. We developed it in France with Curated and Sanofi pharma. So I'll come to pharma in a minute. And well, it's aiming to help the patient adjusting his daily treatment. So that's something that is complementary to MySugr solution, I would say. Well, we had discussion with MySugr sooner, a month ago actually, but we know them very well. It's just another type of solution, and the reason why we discuss with pharma and medtechs is because we believe today that they need to go beyond the pill, beyond the device. They need to provide solution to go deeper and to go closer to the patient. They need to well, prove in real life the benefits of their solutions, and well, the payers are very pushy in this direction. So this is why they need to find a solution to go closer to the patient, and this is what we propose to them. On the other hand, they have a unique expertise today in terms of disease, in terms of reach to HCPs and reach to payers, and this is good for us too, because one of the difficulties to convince payers to pay for digital solutions. But well, I'm quite sure we will mention this.
Okay. Another question for you, Etienne, and your colleague, Pierre Laurent, which you mentioned before, but we are as happy to have you here, no worries about that. So he said that one of the reasons why you got this huge funding this year was that you plan to expand your business in the US. And so what's behind there? How important is the US for you?
Well, we were in the US since 2010, I would say, well, when we opened our first office there, and when we launched our first solution with Roche Diagnostics in anticoagulation. The US market is a wide market today. European markets are great, but I won't say they are small, because when you talk about chronic disease, there is no small market. Diabetes is a huge disease. COPD is another one, and there are a couple of others that are wide, where the prevalence is big. But well, the US market is wider for sure, with less complexity in terms of regulation and law. Well, every single European market is has a specific law. So in terms of well, you need to combine, when it comes to this solution, the laws on medical device, the law on regulation and data privacy, and potentially medical products, or some other laws that can come to these systems. It's very difficult, and if you need to address multiple European countries, you discover that every single European country is a different case. And I have not mentioned the differences in the healthcare system. So, well, one of the reasons why we managed to handle some funds is because we had a clear view of an expansion to the US market, which provide a great possibilities in terms of return on investments. That's for sure. Well, you need to invest a little more because the market is bigger and there are some differences, but well, the revenue is also bigger. So it's easier to get some money there. So we made a proof of concept in France, and now we want to expand in the US. That's second steps. If there are opportunities in Europe, we'll go there, but it's not a priority at the moment.
Okay, thank you. Eduardo, what are your plans with Keldoc? Are you planning to expand to the US or across borders in Europe?
For the time being, our major focus is France. You have to say that only 1% of doctors in France have online booking. Wow. So, I mean, the market is huge. It's 570,000 people. But the next step is obviously Europe. I agree with what Etienne was saying on these barriers, regulatory barriers coming over. There's also some advantages. Even if every single market you integrate it, there's not only regulation, but there's the way the market works. Who pays for what? Is it the insurance companies? Is it state? Is it the patient? But what I'm finding is that there's also this European community that's building and that's using products in London, in Berlin. There's hubs around Europe that are used to spread the word. And that's very important when you're trying to create a platform, which is our case, a platform of patients and a platform of doctors. Obviously, the US is our secondary market because there's a lot of competition there. And that's another point. Obviously, it seems so much easier to build a business in the US. But you need to understand too that in the US, you always have at least 3-5 competitors that are targeting exactly the same market you are, or a similar one.
So maybe Carl, you can share with us your experience on a highly competitive market in the US. So,
Yeah, absolutely. I feel like 50% of the time, especially when we were first starting in the US, I walk into the meeting room and I can see written on the other person's face, another diabetes app, question mark, which is not how I like to start meetings, but I guess it's my role to try to differentiate us. And I think Ken mentioned some really interesting things about the flood of activity in the medical app world and the important differentiations when it comes to regulatory, addressing data privacy issues. So in the US, we're talking about HIPAA, and actually drilling down how many of the apps on that list, or solutions, as we like to call ourselves on that list, fall into those categories and have a whole company behind them supporting them. So I would echo my co-panelists' comments that it's a challenge. I also think there's some advantages coming from Europe. I think that we in Europe, so we're based in Vienna, we are very much used to the fragmented geography and market. We have to adapt for languages, we have to adapt for cultures that are completely different, which isn't in the mindset necessarily of an American company coming to Europe, certainly. And so I kind of learned that the other way around. I used to work in big pharma, big med device, working at a headquarter office in the US, coming to the French affiliate and saying, here you go, use this. This worked great for us, and now you're on your own, which doesn't always work. And I think that flexibility and almost expertise in adapting is a real advantage, or can be.
Great. Do you have anything to add to that? What do you think is the key characteristic for somebody who wants to grow business in Europe, outside Europe?
Well, I would say you need to be able to adapt yourself quickly, but this is something you already mentioned, Kyle. But well, this is a characteristic of an entrepreneur, not of an entrepreneur who want to grow abroad. That's, if you're an entrepreneur, you need to be able to adapt quickly. And challenges is the what entrepreneurs faces on the daily life. It's a challenge, but challenge is good, and this challenge, we see challenges as opportunities. So the US is a great challenge, it's been great opportunities. You need to be convinced that you're able to overcome this challenge, for sure. You also need to get some advisors, so this is also something we wanted to achieve with our investment earlier this year. You mentioned it sooner, but the funds we chose were the one that were able to accompany, to help us get on the US market, because they can share their experience of startups growing on the US market, but also their network, which is huge, and this is very important to have some advisors when you're a small European trying to conquer the US market. Well, it's a big one. You're not always welcome because you're not a US guy, and well, finding the right keys is very important.
Okay. Well, maybe it's not only about going to the US, but conquer the EU market already. We try our best to establish digital health and innovation in Europe, but still every entrepreneur you talk to, every entrepreneur involved in digital health says it's hard. And so what are now the main barriers, apart from that we have different cultures? What could the EU do about this? Maybe you can...
I think there's several things. There's the medical part of it and the starting a company part of it. On the medical part of it, I think regulation will do a lot of help. If we could somehow try and make regulation which is consistent across European countries, or at least some of the European countries, that would be of great help. Second of all, just as I was mentioning earlier, every single country is different on the way they pay for healthcare. That makes that every single time you change market, depending on the product or service you're selling, you're going to have to change who pays for it, who you're addressing, who you're marketing to. And that creates huge cost for a startup. And on the startup side, obviously, the US has a much bigger and stronger funding mechanism. So there's lots of venture capital funds available to raise money and further develop your company. In Europe, it's obviously growing and it's helping quite a bit, but we're still far from those markets, and we're still, I think, far from this culture of pushing people to create startups, to innovate, to create new concepts. And I think we still have a lot of work to do.
Okay, great. I would like to hear Kyle's opinion on that.
So I was just in Brussels, I think about a month ago at the COSIR meeting where we were talking about potential initiatives for standardization and connecting devices, whether it's insulin pumps, blood glucose meters, continuous blood glucose meters. And I mean, there's discussion, but in terms of actually concrete initiatives to standardize within Europe, as you both just mentioned, we're seeing very little evidence of it, and I think it's very frustrating. And data privacy is another aspect we can discuss. I mean, here being in France, there are some very strict national regulations. At what point are we actually going to actually follow the EU directive on these data privacy and allow for easier standardization across Europe? So that's my number one. And then I would also say, so I've lived in France for a part of my life, and I would say there's, as much as a reference there's a great respect for the French medical system, I think, worldwide. In fact, I think with Obamacare happening in the US, there's a lot that can be learned from what's happened in France. At the same time, I think it's still very much a one-directional communication medicine system. Le médecin est roi. You know, I mean, the doctor is king, and he is on such a pedestal that when patients come in armed with the information which are becoming, you know, normal to have read about on their own, that disrupts and doesn't work well yet, and it's only going to be a question of time. So I think one of the barriers is also kind of an inherent stubbornness of healthcare professionals in Europe, if I may say.
Okay. Do you have to add anything, Etienne? You don't have to.
I don't see much to add. Well, except to say maybe that there are also some advantages in Europe. There are very different health models because the countries are different, and there have been many initiatives because trying to input the digital health into the regular health systems requires to adapt the health systems. And there are many different health systems in Europe. There are many experiences that prove what is achievable, what makes sense, and what creates value for patients, which could be different in a single market like the US, because it would be more difficult to try so many different health organizations. So there are some opportunities. We have seen very good experiences in Scandinavian countries. Also, payers are moving in Europe as well. There are some payers paying for a digital solution in UK, in Netherlands, in Scandinavian countries, in Austria. So things are moving, and European market is great as well, but not as big as the US.
Okay, I have one final question for you all. I have to take the opportunity, if I have three great minds on stage, to ask, where do you see digital health in 5 years? What place will it take among pharma industries and the healthcare system, and medtech companies? Maybe you can share just a short vision with us.
Well, I would say, to getting back to our software companion vision, what we would love to see is every single box of pills is provided with an app that you can download on the store that will help you to take your dosage and to know how the pill is more efficient, how you can make the pill more efficient. So this could be a vision. Don't know if 5 years will be sufficient, but this could be a vision.
Okay. Eduardo, want to...
I think in the next 5 years, what I expect is at least simplifying the life of doctors, making them spend less time on admin and on pre-phases where the added value is less important. I think that's a huge vague. It's something we're working on. But I think what's going to be the most interesting, and we're seeing a couple projects around here that are working on that, is all the data that we're gathering. And I'm pretty sure that in 5 years' time, we're going to start having huge lumps of data that we didn't have. We used to have, healthcare used to be more static. We take an MRI at one point in time, or we take, I think we're now going to have huge amounts of data pouring in databases, and that's going to be very interesting because, as we have seen today, it's going to change a lot of ways the ways we tackle diseases, the way the physicians treat diseases too.
Okay, great. You're the last one.
I just add a small word in the middle because, well, it gave me another idea. So I would say that hopefully in 5 years the payers will believe, as we believe, that digital health can improve patient lives. And hopefully in 5 years it will be much more easier to get some money for digital solutions.
Great.
So I think you touched on 3 different areas in terms of kind of where digital health will fit into them. You talked about industry, I think of big pharma, medical device, you talked about governments. For the first two, I mean, for industry, for me, we're already starting to see a lot of change in the sense that I'm speaking with industry representatives at big pharma that are saying, we understand that we're not an app development, a digital health company. You guys do that. We want to partner with you. We need to know that you're an ISO compliant company, that you've done your regulatory, your data privacy homework, but we're willing to work with you in a way where you can keep it what it is, versus I think what we've seen at certainly medical device companies is data management software looks pretty similar across the board, I'm talking within diabetes, the industry I know, versus something that is, you know, what a consumer is ready to digest, like the video, at least what we're trying to do with MySugr products, and I think there are a number of other examples as well. So for me, it's going to be an acceptance of separate development and work in digital health by companies like many represented in the room. And then on a government standpoint, I think we saw a great example with Omada Health this morning. Sean was explaining what's going on with the CDC, and just as you mentioned, government backing of programs where we can reach a whole lot more people through virtual and digital solutions. So that's my 2 cents. Thank you.
Thank you so much. Thanks, guys. Thanks, Etienne, and thanks, Eduardo. Please applaud to these great minds.